This is Nathan Radcliffe with Interventional Mindset. I am a glaucoma and cataract surgeon, and I wanted to spend a little time today talking about how we approach the topic of Dexycu, or dexamethasone 9% intracameral suspension, with our patients at the time of cataract surgery. It's important to understand that when patients have already committed to having cataract surgery, they're generally amenable to other therapies that may complement that surgery. This is the basis of microincisional glaucoma surgery, most often added at the time of cataract surgery, and because it does not affect the safety of the surgery, patients are more than willing to try to get off drops and get their pressure lower. I found talking to my patients about Dexycu that universally they're accepting of this therapy. Now, there are some selling points that we can explain to them. They won't need to take eye drops for steroid, for inflammation after, and most patients are happy to hear that they will have less of a drop burden after cataract surgery. Some patients who are given off-label, intracameral or intravitreal antibiotics may not need antibiotics after, depending on the surgeon's practice pattern. But in any case, any patient who can have less of a burden with drops after is usually up for it. In terms of talking to the patients about what to expect, you can let them know that there's an off chance that some of the implant will be visible to them or to a family member after, and that it dissolves over time. I think it is important to recognize that there are not a lot of FDA-approved therapies for inflammation after cataract surgery, and that Dexycu has been through that rigorous process, and so they are actually getting a therapy that may have been more carefully studied than the standard of care, prednisolone acetate, or something along those lines. One topical aspect that's come up with Dexycu is how in the time of COVID, this can be an added benefit to patients. You know, when we have patients prescribed medications, they may need to go to the pharmacy to get those medications. That is added risk. Additionally, patients need to touch their face when they apply eye drops, when they're applying eye drops up to 4 times a day in some cases. Having the medicine already in the eye is of great value. My own personal experience with COVID and Dexycu was that I had done some cataract surgery with Dexycu just before my office shut down as part of the pandemic. And fortunately, we had many patients who were out there who weren't able to come back for visits out of precaution of safety, but fortunately they were treated with Dexycu and I knew their inflammation would be under control. That gave me comfort, and it proved to me that the approach of using Dexycu is a good one and that it can help you prepare for the unexpected. I also use a lot of Dexycu in my glaucoma patients, and there I think the benefits are even greater. I have presented data showing that we do not have additional pressure spikes when we include Dexycu as part of a glaucoma therapy. But again, think of the glaucoma patient who comes into cataract surgery already on 2 or 3 drops. If we can take even just one of those drops out of the postoperative regimen, we'll have greater success with compliance. We know that from the data. Additionally, our glaucoma patients may be getting off medicines if they're having MIGS, and so when I combine Dexycu plus MIGS, and I can get patients off all of their drops or most of their drops, the gain from cataract surgery is even greater and the patient is even happier. In summary, offering cataract patients and glaucoma patients Dexycu has been incredibly valuable to my practice. I hope that these tips in terms of how to address this and reasons you may benefit from using Dexycu has been helpful to you. And next, I'll show you a video demonstrating some of the surgical techniques that can help you have an excellent intraoperative experience with Dexycu. Thank you very much.